Hi, everybody. It's Adam with HeartValveSurgery.com, and this is a special conversation about patient expectations after heart surgery. I am thrilled to be joined by Dr. Joanna Chikwi, who is the chair of cardiac surgery at Cedars Sinai Medical Center in Los Angeles, California. During her extraordinary career, Dr. Chikwi has performed thousands of cardiac procedures, including many heart valve repairs and heart valve replacements. We are also very lucky to be joined by Leila Saeed, who is one of Dr. Chikwi's patients and a wife, mother, and dentist from Southern California. Dr. Chikwi, it is great to see you again. Thanks for being with us.
Hey, Adam, it's great to see you again, and it's really good to be with the HeartValveSurgery.com community today.
Yeah, and Dr. Chikwi, we are thrilled to be with one of your patients who is Leila Saeed. Leila, thanks for being here today.
Good morning to both of you. Nice to be here.
Yeah, so let's get started. And to begin, Leila, let's hear a little bit about your mitral valve story. I'm curious to know, what were you diagnosed with? When were you diagnosed? And did you have any symptoms?
So back in 2000, on a regular routine checkup, I was told that I had heart murmur. And my cardiologist did a couple of more tests, and they told me that I had mitral valve regurgitations. And for the next 20 years, I lived with it, and I had no symptoms.
Dr. Chikwi, you see thousands of patients there at Cedars Sinai in Los Angeles. I'm curious to know, is Leila's situation, which included a long watchful waiting period and no symptoms, is that common?
It's really common. I would say about half the people I see in the office don't have symptoms. That covers a huge range, from people that have just dialed down what they do, so they're not really doing a lot and they feel fine, to people like Leila who can literally run 5 miles without a problem. And one of the reasons for this is that cardiologists were traditionally taught that you wait until symptoms until you send somebody to fix the valve. And we now know that's not the best way to handle this for the vast majority of people with severe mitral valve regurgitation and a floppy mitral valve.
So Leila, how did you think about the progression of your disease relative to your practice as a dentist?
I compare that to a little filling on the tooth, that you can do a simple filling, or you can just wait until you do a root canal and a crown potentially extraction. So if I were to explain it to the patients, I would say do a filling. It's just much more predictable than waiting until it hurts. Because a lot of patients tell me that it doesn't hurt. Why should I do it now? And I tell them, oh, I wish I could just show you what's going on actually within the tooth. So that is my kind of explanation to people who want to wait.
So Dr. Chikwi, you've got Leila, her valve disease has progressed. She now needs surgery. What is your recommended approach for treating a patient like Leila?
So the operation I did on Leila is the operation I would want for myself, which is a beautiful repair that works nearly perfectly and is going to last a lifetime. And my preference would be a very small incision, ideally between the ribs so that we don't have to cut any bones. So my standard approach is using the robots to achieve that, because a robot allows you to do a super precise repair through a tiny little incision, which is probably not much bigger than the short end of a credit card, sort of over here on the right-hand side. That allows you to hopefully get out of hospital much faster, get up and a lot sooner than if you've had that incision down the middle. Leila, maybe you can speak to what that was like and how the recovery was.
So again, I go back to dentistry. I tell my patients that the recovery was easier than recovering from wisdom teeth for me. And that's actually the truth. The first couple of nights was rough. It was rough and it was expected. Initially, the first day I did have some pain, but I had the exact dates actually. My surgery was on the 18th. I was dismissed on the 22nd back home. Almost exactly a week later, I did a 10-minute walk with my husband up the hill. December 6th, I was back to work, full schedule. I was a little tired that day, but that's about it. Pain level, I don't think I took pain medications after day 5. I was really comfortable. It was just a discomfort was sitting down, standing up due to stitches, but really no pain. Now add to this one that nobody knew that I was getting a heart surgery prior to it. Just I don't like to get opinions from people. I don't like the extra chiming in. Oh, are you doing it? Details. It was just my husband and my sisters. Not even my parents knew that I was having a heart surgery done. And afterwards, they were all thinking that it was some small procedure I had done, and they thought that I recovered pretty fast from that small procedure.
Congratulations to you both. And Dr. Chikwi, I want to dial it back. We just heard all this great information from Leila. For patients out there who are looking to get more general expectations, what do you tell patients about things like, well, maybe we just start with pain management? What should a patient expect specific to pain?
Well, I have to say the HeartValveSurgery.com is a great resource, because what a surgeon thinks a patient needs to know about pain is often not really what patients in retrospect wish they'd known about pain. So I'm curious to hear from Leila's perspective if the advice that I give, which is I expect by the time you leave the hospital, most people are managing fine on just Tylenol, and it might hurt when you laugh or you sneeze or you cough, but you should be able to walk around comfortably. Is that true? Or should we be giving patients different advice?
I think it was absolutely true. I think I even recovered a little bit sooner than you had expected. So you gave me 4 to 6 weeks. I think mine was more like 2 weeks with very little pain. In fact, I didn't even need the Tylenol on day 5. I went medicine-free after day 5.
Dr. Chikwi, another question that patients often wonder is about, hey, when can I drive again after surgery?
So cardiologists seem to have a more conservative view. I usually tell patients, as long as you're not taking narcotics and you feel comfortable behind the steering wheel and you can pull a handbrake and you can turn around, you're good to go. 2 weeks.
And Leila, let's go right back to you. When were you driving after your surgery?
You know, I was just, I was not going to share this, but I'm going to share this with you. And I was dismissed on Monday, and my older child sprained her ankle on Wednesday, and she really needed mommy's attention. So I got behind the wheel and I drove her to her orthopedic surgeon. So that was day 5 or 6. And, you know, it was just getting in the car was a little uncomfortable, but I used my little heart pillow to protect my chest, and it was comfortable. Driving was not a big deal. Getting in the car and getting out was a little uncomfortable. Granted that was day 5 after my surgery.
This is amazing to hear, because I was not behind the wheel as a patient for 4 weeks after my procedure. So that's fantastic. Moving on to another question, Dr. Chikwi, that I get all the time. It's a personal question, but it's about sex. When can I have sex after heart surgery?
I usually say as soon as you like, as long as you're not doing any heavy weightlifting.
And when you say as soon as you like, is there any time frame you say do not do it before?
No.
Okay. One more question that patients have about their expectations after surgery is, when can I go back to work?
So that really depends on whether your work involves very physical work, heavy weightlifting, driving or not. Some people are sitting up in bed on their laptops, sending their emails day 1. And again, if you're not taking narcotics, it's a desk job as soon as you feel ready. If it involves heavy lifting, about 2 weeks if you've had a sort of mini incision. It's a little bit longer if you've had an incision in the middle, maybe about 4 to 8 weeks.
Leila, what are your thoughts about going back to work after your procedure?
Oh, I went back to work 2 weeks later, and I was a little comfortable on day 1, but just because I do a lot of slouching, bending over. But other than that, I went back to work full schedule on day really 14 after the surgery.
One thing I do tell patients, and again, Leila, I'm curious if this was your experience, that your mental stamina is sometimes just a little bit less. And so I advise people, if you can, don't go back for a full day, go back for shorter days, because by the middle of the day, your tolerance for putting up with people, long conversations is just not going to be there.
That's true. That is very true. I think my ego a little bit got in my way. I'm sharing this with you too. I really did not want people to know what happened. So I was trying to just tough it out. And that trying to toughing it out was really helpful. It just kind of powered me through the whole thing much faster.
Dr. Chikwe and Leila, I love hearing about kind of not just the physical side, but also the mental side. And I've got to ask this question while I've got you on the line, Dr. Chikwe. Cardiac rehab is something that I hear is often underutilized for patients who may not have such a great recovery as Leila. Can you talk a little bit about what cardiac rehab is and how it might help patients as they recover?
Patients like Leila, you can go and see what rehab's like, but you'll be so far beyond what they're able to do that it's probably not going to be worth your while. But I think for much older, frailer patients who really want to do graduated exercise in a much more supervised environment, one, and two, find a community of people that may be going through similar challenges. Cardiac rehab is incredibly valuable, and we've got to do a better job of ensuring everybody has access to it.
Leila, I've got to ask you, and I'm sure a lot of patients are wondering, what is your number one piece of advice for a patient specific to expectations after heart surgery?
Having read so much prior to the surgery, I was expecting a much longer recovery. The recovery was much easier for me. It was, I went back to work much faster and sooner than I'd expected. I'm just glad I did it when I did it. I think I had the option of prolonging that and waiting. But at some point I decided that if we're going to do the surgery, better doing it sooner than later. Again, the recovery was much more predictable. I was always an active person. It only took me 2 weeks to be back to my normal life. I do believe that we should all defer to ourselves to see how we feel afterwards. The 4 to 6 week is the norm they give people. You might feel much more comfortable a week later or 4 weeks later. I happen to be one of the ones who felt much more comfortable 2 weeks later.
Leila, I loved hearing about your recovery and how quick it was. I also love the fact that you talk about the uniqueness of patients, that some patients might recover faster than others, and you can't rush it, right? And Dr. Chikwe, I'll pass the torch over to you. Any final thoughts about patient expectations after a robotic mitral valve repair?
The anticipation, like Leila said, is almost always worse than the reality. You'll be amazed what you could do. And with an amazing nursing team, it's a ton easier than you think.
Fantastic point, Dr. Chikwe. And let's dig deeper on that. Leila, how important was the immediate aftercare provided by the nursing team at Cedars?
Kind of care that I got in that 2 or 3, 4 days afterwards was just as amazing as the whole experience of getting the surgery. These people so truly cared. I tried to make a mental note and go back to my office and then share with my staff that this is how I felt. I felt so special and I felt so important. Every time that I requested something, it wasn't just, I'm doing it because this is, my job, I'm doing it, I have to bring it to you. It was with really full heart and a lot of sympathy for the patients. And there was a lady, Mama Rosa, I can't say enough about her. I've shared that with you. One night I just broke down. I started crying because it was just overwhelming for me, day 2. And she just sat down next to me and she rubbed my back and she hugged me and she kissed me and she held me until I was comfortable. These are the things that people need to know, that it's not just this surgery per se, it's what happens after that in that facility that makes the whole experience so much better.
I'm so glad you said that. The nursing care is so important, and we are really blessed. We have these spectacular nurses who can make a difficult experience, however perfect the surgery is a difficult experience to go through, and they transform that into an amazing experience. And literally, patients will see a doctor for maybe 5 minutes a day, a surgeon for a few minutes. The nurses are there 24/7. That's who gets you through this.
Leila, I've just got to ask, this is a wonderful situation. We've got you on the line. We've got Dr. Chikwe on the line. Is there anything that you want to share with Dr. Chikwe?
I'll be happy to. I sent Dr. Chikwe a small bouquet of flowers. And I in my letter, I said, if I really wanted to thank her with flowers, I would have to send her the entire flower shop. What she did was beyond just what an amazing surgeon would do. It's just her attitude, her demeanor is so calming, so soothing. I remember just vividly that the day of the surgery, when I was absolutely terrified on the bed, tears were running down my face. She came to say hello to me. And she looked at me and said, look, if you still change your mind, if you don't want to do it, don't do it. And that was the moment that I felt so relieved that I'm not under stress, I'm not under pressure. And I just closed my eyes. I said, I'm going to trust her. Every time I saw her, she's just so patient. Like you can tell that she cares. She's not in and out. So she'll just answer and she's out next to the patient. She sits down. She looks at you like she cares. Like you are the only person who matters at that second. Answers all the questions and beyond. And then at the end, she says, look, I'm here to answer more questions. And I, as a dentist, have learned that. And I'm trying to do the same thing in my practice, just give patients that calming and soothing feeling that I'm here for you. So I've been practicing to be more like Dr. Chikwe in my practice.
Dr. Chikwe and Leila, on behalf of the entire patient community at HeartValveSurgery.com, thanks so much for taking time away from your very busy practices and sharing all these insights about patient expectations after heart surgery. Thanks for being with us today.
Absolute pleasure. Thank you very much, Adam.
Thanks, Adam. It was nice to be with you.
Hi, everybody, it's Adam. I hope you enjoyed that video. And don't forget, you can always subscribe to our YouTube channel, watch the next 2 educational videos coming up on your screen, or click the blue button to visit HeartValveSurgery.com.